Hello, my name is Dr. James Weiner, W-I-N-E-R. I'm director of the Weiner Wellness Center, located at 2419 Baldwick Road, Pittsburgh, Pennsylvania, 15205. Our website is drweiner.com, drwiner.com. We have two Facebook pages, one at Weiner Wellness Center and one at James Weiner. Also, we're on Twitter at drjamesweiner. Our phone number is 412-922-WELL or 412-922-9355. We're going to talk about joint and bone problems today. Anyone here have arthritis? No one has arthritis in this entire crowd? No arthritis? Osteoporosis, bone loss?
Only when you eat meat.
Bone loss? Anyone on bone drugs like Fosamax, Avista, Reclast, Beniva, Forteo? Not on any of that? Okay, that's good, because I didn't even pass that up, but we do have information on that by the food table. You'll see we have that metal spindle with a lot of free literature. Now, many of you probably listen to me on the radio. How many people have never heard me on the radio? Let's see a show of hands. Okay, well, you have the radio schedule now. Did you get the radio schedule? Okay. And this literature is very valuable. Hopefully you'll take some time after the talk to check it out. How many people think that in order to build bones you need to drink milk or eat cheese or ice cream or things like that? How many people believe that? You believe that? Okay. Now, there has been a huge marketing campaign over the last 75 years or so by the dairy industry. There's a thing called the National Dairy Council. I remember when I was teaching nutrition at a local university here, I thought, well, I wonder where I can get some information. And of course, I knew about the National Dairy Council, so I sent away for their information because I wanted to see their propaganda, because that's basically what it was propaganda. Remember the 4 food groups? Group number 1 was milk products. That was invented by the Dairy Council. You know, I would love to have, some sort of thing like that that's handed out to virtually all the school children. I found out, they told me that something like 92% of the parochial schools and 95% of the public schools in the United States were using their materials. They were brainwashing the children and their parents with all this information. And I would love to enforce that you had to maybe come here once a month or once a week, or how about every day? Because that's what they were saying. You need 3 servings of milk every day. And of course, then the government gets into it, and they have milk at every meal in the schools. Now, we could do this whole talk just on milk, but we'll just talk a few minutes about it. First of all, cows look a little different than human beings. You know, a grown cow might weigh 800 pounds, 1,000 pounds. Did you know that? There are not very many human beings that weigh that much, and if they do, they're in serious trouble. Did you know that cows don't drink milk after the weaning period? After a few months, the mother cow doesn't feed the milk to the calf. And yet we have adults consuming milk every single day, adult human beings. Did you know that cows have 4 stomachs and we only have 1? Did you know that the constituency of the ingredients of cow's milk is totally different than human mother's milk? So the bottom line is, we're not supposed to drink milk. And what are they doing to this milk now? Hormones. I had a guy in that was a dairy farmer. He told me they can get 5 times as much milk out of a cow now as they could 20 years ago. Incredible amount of hormones in the dairy products, because they give these cows female hormones so they can keep producing milk, even if they're not pregnant or didn't just have a child. And of course, they end up dying after 3 or 4 years, so they're so worn out. And how about the preservatives like formaldehyde in the milk? How about homogenizing the milk? How about pasteurizing the milk? How about the residue of pesticides from the feed that the animals are getting? All of this is in your milk. Milk is very high in phosphorus. Phosphorus leaches out calcium from your bones. It makes you very acidic. And in fact, studies now show, and you can go on the internet and type this in, bone loss due to cow's milk or cow dairy products, and you're going to find out that studies have shown that consuming cow milk products actually causes bone loss or osteoporosis, just the opposite of what you've been told. You know, they had this big ad campaign a while back with billboards all over the place, got milk, and then they showed this little white mustache on famous people, including, I think, one of the governors, and they had baseball players and all kinds of well-known celebrities promoting this, probably well-intentioned. Of course, as I often say, the road to hell is paved with good intentions. You may have a lot of people that tell you, don't come to the Wired Wellness Center. Stick to conventional medicine. Anyone relate to that? Anyone giving you a hard time for exploring natural healing? Let's see a show of hands, okay? I had a guy in here yesterday, 71. I'm almost 68. He looked about 20 years older than me. And he had a frozen shoulder. He could not lift his arm past about here. We call that flexion. He couldn't lift it past about here. That's called abduction. In less than 3 minutes, I fixed it. I wish I had had the videographer in the room, but he was out here taping the classes. And just then, a friend of mine called up. And I said, wait a minute, I want this guy to tell you what I just did for him. He said, Dr. Weiner fixed my frozen shoulder in less than 3 minutes. What if you go to the conventional doctors for that? They probably want to do surgery or months of physical therapy. We have all kinds of testimonials, people that had cancer, some of them so-called terminal cancer, and overcame it through natural means. So minds are like parachutes, they only function when open. And knowledge is power, so you have to learn about how to take care of yourself. You see, you're born, you're not given a manual. And your parents weren't given a manual. And your parents probably did what they thought was best for you. In most cases, it may not have been best for you. Like giving you milk every day. We have found that milk is one of the most common food allergens. We don't have 4 stomachs. The ingredients of the milk are much different than human milk that we were designed to handle, and it's pasteurized and formaldehyde and homogenized. In fact, when I was the associate director of the Price Podger Nutrition Research Foundation in California, we actually did an experiment on a farm. We took the cow's milk, pasteurized it, and that's all we did. We didn't add all those other additives, and gave it to the baby calves. They all died. Once it was pasteurized, even the baby cows couldn't handle it. We know that it clogs the arteries, causes calcification of the arteries. We know that a lot of people with asthma and breathing problems have it from a milk allergy. How about sinus problems, chronic so-called ear infections in children? How about depression? Depression from milk. We have a whole article on food allergies talking about how foods can cause mental and emotional problems. In fact, we used to have a speaker at my health expos 35 years ago, Dr. Marshall Mandel, and he would talk about food allergies causing weight gain. We had another speaker, Dr. William Philpott, who wrote a book called Brain Allergies, and he would talk about how food allergies can cause mental and emotional problems. So we find that dairy products are one of the most highly reactive foods in the human body, including causing all kinds of inflammation, and that's one of the big areas of research now in modern medicine is inflammation. They're finding that clogged arteries are the result of inflammation, of course, various types of arthritis and various problems, including brain problems, inflammation, immune system reacting to things that it doesn't want in the body. So dairy products, very unhealthy, especially the way the dairy products are here in the United States. Now, some people are wedded to the idea of taking whey, W-H-E-Y. So in Nutritional Frontiers, we're providing you whey, but it's not from the United States dairy farmers. It's from New Zealand, where they're not allowed to use any of those chemicals. So you're not going to build bones with dairy products. You're going to actually ruin your bones with dairy products and possibly cause all kinds of other complications. Now let's talk about these drugs, even though no one here is admitting to being on these medications. The bones are constantly rebuilding. Maybe you know this, that you don't look the same as you did when you were 10 years old. You don't look the same as you did 10 years ago, by and large, because you're not the same. You were replacing every cell in your body at least every 7 years. You have a new intestines every week. The intestines you had last week are not the intestines you have this week. Your hair, you know, the hair you have in your head today is not the hair you had a couple of years ago unless you've let it grow really long. So your body's constantly rebuilding itself, and the bones are no exception. You have two basic cells in the bones. One's called the osteoblast with a B like boy, for like building. Osteoblast, just think building. And osteoclast with a C, and they break down the bone. So what happens is your bones, the cells in the bones start to weaken, and they start to get brittle. And so your body is constantly getting rid of the old bone and replacing it with new bone. Now when you have a net loss, meaning you have more breakdown than buildup, then you start getting osteopenia, eventually osteoporosis or bone loss. These drugs, these bisphosphonates, Forteo, Reclast, Beniva, Fosamax, Evista, what they are geared towards doing is stopping the breakdown of old bone. So what happens is eventually you have all old bone. And when you have all old bone, it's brittle like a piece of chalk. Some of you are old enough to remember blackboards in school, when the teacher would be writing and then the chalk would break off in his or her hand, and if it fell on the ground, forget it, it's going to be shattered in a bunch of pieces. That's what happens to people's bones. People actually have spontaneous fractures when they have enough osteoporosis. It's not that they fall and break the bone. Very often the bone breaks and then they fall. I give an example. I have a friend in California. He consumes 10 to 12 cans of soda pop a day. Soda pop is very acidic. Not only does it have phosphorus, it actually has phosphoric acid and carbonic acid. In order to neutralize that acid so you don't die, because your bloodstream has to be the opposite of acid, it has to be alkaline, your body will take minerals out of your teeth. And we have pictures that Dr. Warren, our last speaker, provided over there on the wall, showing a 17-year-old kid whose teeth were rotting from soda pop. And we'll take it from the muscles and bones. So what happened to my friend last year, he stood up to get something, and as he was reaching overhead in his kitchen to get a glass, his thigh bone broke and he fell to the floor. Fortunately, his wife was home, and he had to have a plate put in. And the guy basically has been in a wheelchair for years because he spontaneously breaks bones because his body is so acidic from consuming soda pop and a certain amount of dairy. So the thing is, they now found that these bone drugs actually cause bone fractures as well. Because why? You're going to end up with all old bone, and it's going to be brittle like a piece of chalk. And it may break with the slightest pressure, just like the chalk on a chalkboard. So what are we going to do about it? How many people eat beef? Let's see a show of hands. Beef. Okay. How many people eat chicken? How many people think chicken is better than beef? Let's see a show of hands. Okay. I actually think chicken is even worse than beef. Now, I've been a vegetarian since 1970, so it's over 44 years. A lot of people say, where do you get your protein? But those of you who raised your hand and admitting to eating beef, like hamburger and steak and all that, Where do the cows get it? They're vegetarian. Where do they get the protein to make those muscles that you're eating in your steak or hamburger? They're getting it from vegetable sources. That's where I get my protein. Okay? Animal protein is very acidic, and it's very high in phosphorus. So that's another reason why you have so much osteoporosis and bone loss in the United States. We have a whole packet on meat over there, several articles that you can pick up over there by the food table on that metal spindle. Okay, so what are you going to do if you are diagnosed with osteoporosis or bone loss? Are you going to take the drugs that actually interfere with the rebuilding of the bones and actually stop the breakdown of the old bone? No, what you need to do is give the raw materials that your body needs so that those osteoblasts, the builders, can build. You know, you can have a wonderful architect design a building, you can get the best craftsmen, carpenters, bricklayers, whatever, and then if you don't deliver the materials, the bricks, the boards, whatever they need, they can't build. So you've got those builders right inside your bones, but they need the raw materials, and they also don't need to have them leached out. And we didn't even talk about drugs. How many people are on diuretics, Lasix, diuretics, hydrochlorothiazide? Anyone on that for either fluid buildup or high blood pressure? You're washing out your minerals. How many people are on antacids, Protonix, Nexium, Prilosec? Those interfere with your absorption of minerals too and cause bone loss. So there's a lot of reasons why people are losing bone in the United States. If you're inactive and you're not putting enough stress. For example, they found the astronauts when they went on the moon and other places, when they were free of gravity, they started having bone loss. Our bodies are designed to have a certain amount of stress against them. So if you're a couch potato, you may start losing bone and muscle mass as well. So at least do some walking. In the wintertime, you can walk in the shopping malls. You're worried about the ice and the cold weather and everything. So you can do a certain amount of, low impact exercise. It'll help your entire system. So what we've come up with is a product called Super Cal Plus. Because I know a lot of the bone formulas that the doctors were recommending, the medical doctors, actually were very bad. First of all, they had calcium in the wrong form, like calcium carbonate, ground up shells or rocks that your body cannot absorb, calcium carbonate. The worst absorbed form of calcium. And of course, that can lead to clogged arteries and everything else if your body can't utilize it. And then it also causes magnesium deficiency because you need magnesium with calcium. But not all forms of magnesium are well absorbed either. So we have a comprehensive formula. You need vitamin D, and doctors are now admitting that most people are very deficient in vitamin D. We know there's a relationship between multiple sclerosis and vitamin D. The further people move away from the equator, north or south, the more likelihood they have of multiple sclerosis and bone loss and everything else. And it's probably because of the less sun, less direct sun. Of course, most of us aren't in the sun very much anyhow. And then if you go sunbathing and you take a shower right away, you're not absorbing most of vitamin D anyhow. You have to let the sun sink in. It's formed, the vitamin D is formed in your skin, and then you have to wait at least half an hour after a sunbath before bathing. Vitamin K, very necessary. Now, a lot of people are on blood thinners. Anyone here on blood thinners? Pradaxa, warfarin, Coumadin. You're probably told to stay away from green leafy vegetables because green leafy vegetables have vitamin K. And they don't want to bother trying to adjust your dosage. So they want to simplify it for themselves, the doctors, so they tell you to stay away from green leafy vegetables. You know what happens? You're lacking vitamin K and you're lacking magnesium because one of the major sources of magnesium is green leafy vegetables. Chlorophyll. Chlorophyll has magnesium in it. Actually, the chlorophyll molecule and the hemoglobin molecule are almost the same, except In animals, we have iron at the center of that molecule. Plants have magnesium at the center of the molecule. So chlorophyll is like the blood of plants, so to speak. And when you eat green plants, you're getting a lot of magnesium. But if you're told to stay off the magnesium because you're told to stay off the green leafy vegetables, you're going to be vitamin K deficient and you're going to be magnesium deficient. And guess what? If you're magnesium deficient, it increases the risk of a heart attack because your arteries may constrict and also weakens your heart muscle and all your other muscles. A lot of people have headaches. A lot of people that have muscle cramps, it's because they don't have enough magnesium. It's one of the most common deficiencies. So in the Super Cal Plus, we put the magnesium in there. We put the vitamin D in there. And the right formulation, D3, we put the vitamin K2 in there. We have trace minerals like boron in there. And we even have some betaine hydrochloride to make sure you have enough hydrochloric acid to break down the minerals. And we've had phenomenal results with people rebuilding their bones taking the Super Cal Plus. Now we need to talk about postmenopausal women. And very often they'll give you estrogen replacement. We know most forms of estrogen replacement actually can cause heart attacks and cancer. They had this whole big study, the Women's Health Initiative. Some years ago they had to stop the study because the women were having a dramatic increase in heart attacks, strokes, and cancer. So it's not just a matter of estrogen. If you want to build up estrogen, progesterone, postmenopausal, we do have supplements for that are safe. Okay, so we've talked about bone health. We need to talk about joints. What are joints? Joints are where two bones interface. Now, in order to protect the joints, you have what's called cartilage. In some places, it's called by a different name, like in your spine, it's called the disc. In your knees, it's called the meniscus. But it's basically cartilage, which is this soft, fibrous, resilient tissue that's smooth and then enables you to move without any kind of roughness impeding the movement. In other words, if we were just one bone, you'd be like a statue. You couldn't move. So we have these articulations. The average person has about 206 bones. There is some variation in the number of bones that people have. But most people have around 206 to 210 bones. See, some people have extra vertebrae, extra ribs. So there's a little bit of variation. But where these bones interface, that allows movement. You know, if you look at my hands, see, I got all these different joints in my fingers. Right? There's 14 joints in the fingers themselves. You got 3 of each of these 4 fingers, and then you have 2 here. That's 14 just there. And then you got all the other joints in the palm of your hand. And then your wrist. You have 10 bones in your wrist. And that's how you're able to move. You know, the joint that has the most movement is your shoulder. You know, if you're okay, you can make a big circle. You can bring the arm all the way up here, bring it all the way up here. That's a joint. Now, sometimes people have joint pain and limited range of motion because of the muscles. And that's what happened yesterday with this guy that had the frozen shoulder. If you have a tight muscle, just imagine if I were pulling on my sleeve here, I couldn't lift my arm up. Well, there's a muscle that actually runs there. It forms the back of your armpit called the latissimus dorsi. If that is tight, you won't be able to lift your arm sideways. Okay? If you have trouble putting your hand behind your back, that could be another muscle in the shoulder blade, the infraspinatus. So there's a handful of muscles that will, if tightened up, cause restricted range of motion in your shoulder. And you can get pain referral, which means that you may have pain in one part of your body, but it's really coming from somewhere else. You can have tingling and numbness in the fingers, and it may be coming from your throat muscles, because the nerves that innervate your fingers come out of your throat and run all the way down your chest, down your arm, down your forearm, into your fingers. So if the muscles are being squeezed here, you may feel in your hand. I got to tell you, so far, you probably know more than most orthopedic doctors and certainly most GPs, just having attended this lecture about this subject. So if you do go to conventional MDs and start telling them this, I think they're going to be shocked. when you tell them this information, because they don't know this information. They don't know that 80% of the musculoskeletal pain comes from tight muscles. They don't know that a lot of so-called arthritis pain is mislabeled, that's actually coming from tight muscles. So you can have knee pain because you have tight thigh muscles. And if we loosen up those muscles, which we have therapists here to do that, then suddenly the pain goes away. But what if you really do have a joint problem? There's degeneration of this cartilage that we talked about. You don't want to have it cut out. This guy I mentioned earlier in California, he and I had the same knee problem. I injured my knee. It blew up like a basketball. There was all this fluid in there. I would let the doctors take the fluid out because I realized if you take the fluid out, you're eliminating the cushioning effect of that fluid that the body put in there for a reason. And also that fluid contains nutrients to rebuild the damaged tissue. And I had a guy in here recently, and since the last time he was in here a few months ago, he didn't have this problem before, he said he injured his knee and it's swelled up. He went to the medical doctor drained it, and within 15 minutes he had terrible pain and had trouble walking. And so he comes in here 2 weeks later, still has the problem. He didn't have that problem when it swelled up. I said, well, you just sabotaged what your body wanted to do. Your body was doing the right thing. See, there's this bias that the medical doctors have, thinking that when you have a fever or you have a tumor or you have fluid or whatever it happens to be, that the body's doing the wrong thing. They don't realize it's part of the healing process. Okay, like a scab is part of the healing process. You don't want to peel it off. A fever helps to kill bacteria and viruses, and maybe even cancer cells. The tumor is the body's attempt to move all the cancer cells in a localized area. But the tumor is not the cancer. The tumor is just a symptom of a breakdown of your immune system and the imbalance of your body chemistry and probably also malnutrition. So we have to look beyond the symptoms. So if you have torn cartilage, the answer is not to cut the cartilage. The answer is not to drain the fluid out of your knee. So this friend of mine in California that has the bone problems, years ago he developed knee problems and he kept having arthroscopic surgery where they kept cutting out little pieces of his cartilage, and eventually he didn't have any cartilage left and they gave him a knee replacement. What happened to me? I took nutritional supplements. And that was 32 years ago. And I can show you this knee. There's no fluid on this knee, right? There's no fluid there. The knee healed itself. The body can heal itself. You were not an inanimate object. You know, someone threw a rock at my car last year and dented the fender. Well, that dent would have been there for the rest of the life of the car, right? I had to have it changed. I had to have a mechanic take it off and put a new fender on there. But you break a bone, I broke my wrist almost 9 years ago, it healed. I didn't have to have hand replacement surgery. So your body can heal itself. That's a concept that's basically foreign to the medical model. Your body can heal itself, but what we got to do is not interfere with the body's functioning by taking bone drugs or antacids or whatever have you. What we need to do is supply the body with the nutrients it needs. So we have this product called HA+. Hyaluronic acid is one of the basic chemicals that your body needs to make cartilage. We have had phenomenal results with this product. People that were scheduled for knee replacement surgery, hip replacement surgery, shoulder surgery, and then they started taking this, and over a period of time, their symptoms went away, and they were fine. Now, healing is a process, not an event. See, a lot of us are conditioned to taking a drug that suppresses a symptom. You know, let's say your doorbell's stuck on your door. Well, you could stick earplugs in your ears. You know, you have to go and disconnect the thing that's stuck. So we're not treating a symptom here, but your body's rebuilding itself. It's not just stopping the symptom like putting in earplugs. We have to rebuild the body by providing the nutrients in a form that can be assimilated and utilized by the body. And then over time, your body will rebuild. Now, I have a friend who's a doctor in the North Hills area. I was best man at his wedding, actually. He called me up a few years ago and said he was scheduled for knee surgery. He was going to have it done over Christmas because he's planning to have his clinic closed for about a week anyhow, because he was going to have to be off work for a few weeks, be on crutches for who knows how long, etc. And I said, wait a minute. Why don't you take the HA Plus that you have in your office? Because this guy actually has this product in his office. He said, you think that's going to do it? I said, yeah, that's going to do it. He calls me up a month later. He's still got the pain. I said, keep taking it. He calls me up another month. Total of 2 months later, I still have the pain. I said, keep taking it. He calls me up 2 weeks after that, so it's approximately 10 weeks. All the pain gone. The body was rebuilding that cartilage, but it didn't get to the point where he was asymptomatic for 10 weeks. The healing process was happening. You know, it's kind of like if you were deep sea diving and you were a couple hundred feet under the surface of the water and you come up 50 feet, it still looks like you're surrounded by water. You come up 100 feet, you're still surrounded by water. Eventually you do break through and you get to above the water. So your body's rebuilding this, but it may take a while for you to notice symptomatic improvement. Because I'd really told him initially, you know, you got to give it 3 months. Now, some people notice a difference in a week, but most people it's going to take 2 or 3 months to notice a dramatic improvement taking these products. All right, so we've covered a lot of bases. We gave you the information on the soda pop, how bad that is. Anyone drink soda pop here? I think you're afraid to raise your hands. You know, well, a little is too much. And if it's diet soda, that's actually worse, because aspartame is a nerve poison and actually raises your blood sugar and actually makes you gain weight. And in this packet we gave you, it explains all of that. All right, so what we're going to do now is we're going to open it up to questions. You don't have to limit yourself to joint problems. Keep in mind we mentioned about the trigger point muscle therapy. I didn't even mention adjustments, because if your pelvis is out of whack, then you may have hip or knee problems. So spinal adjustments or extra spinal adjustments may be important. Trigger point therapy, I talked about various nutrients. Now we're going to go to questions. Yeah.
On the subject of milk, is it the additives in the milk that make it bad? Now, what about natural, organic, whole milk?
Okay, well, maybe you didn't get the whole picture. Cows have 4 stomachs, we have 1 stomach. Okay? So it's not designed for human beings. And actually, cows stop feeding their calves milk after a certain number of months. So most people are allergic to milk by itself, and it's hard to digest. It's too high in phosphorus. Okay, so there's a lot of factors. Of course, you're better off if you get organic milk, because then you might not have all the chemicals and the hormones and all that type of thing. But yeah, I don't think cow's milk is good food for human beings. Now, if it's cultured like yogurt, maybe sparingly once in a while, that'd be all right. But I find it's one of the most common food allergens, contributing to attention deficit, autism, irritable bowel syndrome, asthma, skin problems. I'll give you an idea. I had a staff member here once. Her boyfriend came in. He had these lumps underneath his arms. He was only in his late 20s. He was a fireman. And I said, what do you eat? And I found out he ate cheese at almost every meal. I told him to cut it out. In a matter of a few months, the lumps went away. The body wasn't breaking it down. It was storing it underneath the skin. What was going on in his arteries? I don't know. It might have been clogging his arteries at the same time. We know there's a relationship there. So yeah, I'm not a big fan of milk. If you're going to use any kind of cow's milk, maybe you ought to get goat's milk. It's much, instead of cow's milk, animal milk, get the goat's milk. Or I recommend like almond milk. That's what I use. Other questions? Good question. Yes, Irene. I'm sorry, what did you say? You're talking about magnesium and calcium carbonate.
Well, the almond milk, I looked on the package yesterday, and it has calcium carbonate, because I've been finding out through tests about calcium. So I wonder, what is the best of milk? Should we drink the almond milk then? What is the best of
Yeah, well, yeah, if a product has added calcium carbonate, that's not that great. You want calcium usually, chelated with an amino acid would be one way to get minerals. where they connect minerals with amino acids would be one way. Now, there's naturally occurring calcium, like in carrots or sesame seeds. There's a lot of naturally occurring calcium, and your body can handle that. Other questions? Yes, sir. You're the one on a bunch of medications.
Well, yeah, I'm still here. My wife has bone cancer.
Your wife has what?
She has bone cancer.
Bone cancer. Well, we have a whole packet. You see that wooden shelf right there behind you? We have a whole packet there on our suggestions for cancer. First of all, it'd be like a vegetarian diet. We have a bunch of supplements we recommend, detox procedures. We'd also recommend you get intravenous peroxide therapy. We can tell you a doctor in the area that does that. And so if you talk to me after the talk, I'd be happy to help you. The conventional treatments are not going to help you. So, you need to think outside the medical box. We have a wonderful video that we've posted on our Facebook page at Weiner Wellness Center, as well as on our website, Dr. Weiner. On drweiner.com, if you go to the top menu bar all the way to the right, it says Media. You click that on, then there'll be a drop down, and you click on Videos, and you'll see the link to see Cancer, the Forbidden Cures. It's a 73-minute video. Everyone needs to watch that. Keep in mind, the cancer rate in 1900 was 1 out of 100 in the United States. Now it's 1 out of 2. So either you or someone close to you is going to get cancer in your lifetime. You need to learn about the alternatives now. You can also look up gerson.org, gerson.org. These are all listed on this information I'm going to give you. So have you been doing chemotherapy, or what have you been doing? No?
No, she is. She's on fasted.
I'm sorry, what?
She's on fasted once a month.
She's on what?
Fasted.
She's on some sort of drug once a month. Yeah. Well, that's not the answer. You don't have a drug deficiency. You have a poorly functioning immune system, and your body chemistry is all whacked out. Do you eat animals? Do you eat beef, chicken, fish, pork, eggs? Need to cut it all out.
It's estrogen.
Estrogen-driven, then you don't want to be on tamoxifen, arimidex, Femara, because those cause other types of cancer. We have a whole article there. We have a product called Estro Cleanse. And well, is this metastasized bone cancer from breast cancer? They've never cured metastasized breast cancer. I just got to be honest. Did you ever hear of Elizabeth Edwards? She was John Edwards' wife, who ran for vice president at one point. Very rich people. They told her her cancer was not curable but treatable, which means they could just get away with making a lot of money. You really need to investigate the alternatives as soon as possible, and we'll give you a lot of free information. I also have back there the meat graph showing the relationship of meat and cancer. We have a lot of information that you need to learn about that your doctor's never going to tell you about. And I'll tell you something. We had someone here a few months ago who had advanced cancer, and she said she asked her oncologist about me and said, well, there's this guy here on the radio, Dr. Weiner, and he says that there's natural approaches for cancer. What do you think about them? He said, oh, there's a lot of merit to them, but we don't use them because there's no money in it. You know, cancer chemotherapy can be very costly, can be, can actually, make a lot of money for them. So they're not going to talk about, they've never talked to you about diet, did they? They ever talked to you about diet? They didn't tell you that people that eat animals have a much higher risk of cancer? Didn't talk about that. They didn't talk about detoxification. They didn't talk about your liver not functioning right. They didn't talk about your body being too acid. They didn't talk about any of that.
Yeah, it's actually it's for the bones, there's an enzyme that's developed by the liver, and it pushes your bone out of your body. So she's taking Xgeva, which is supposed to disrupt that enzyme.
Yeah, well, you're looking at the minuscule part of it, not looking at the big picture.
Yeah.
It's like if you have a leak in your house and you put a bucket underneath the leak, you got to see where the leak's coming from. Why is the body chemistry awry? It's because of what you're eating. We'll talk afterwards, but I'm not here to convince you of anything. I'm just trying to tell you, you need to explore, and that's why you came here, hopefully, to explore something other than the limitations of modern medicine. You need to take a proactive stance and not just passively live the same lifestyle that caused the cancer in the first place. See, a lot of people say, I'm not going to let this cancer get me down. I'm not going to change a thing in my life. And that's the most foolish thing I've ever heard. You've got to start examining your life. You may have to change a lot of things in your life because something in your life caused this. It may be toxic relationships, it may be toxic food. You've got to figure out what caused this disease. There's a cause for every symptom. The medical doctors just treat the symptoms. Other questions? Yes, ma'am.
How do you heal tendinitis?
How do I what?
Heal tendinitis. Are there any
How do I eat what?
Heal
tendinitis?
Tendinitis.
Heal
Well, tendinitis is inflammation of the tendons. The tendons are the ends of the muscle. The reason the tendons get inflamed is because the muscles are tight. Okay, so we work on the muscles, they stop pulling on the tendons, that's the end of the tendinitis. Now we do have a product called X-Flame that'll reduce inflammation. But wherever the tendinitis is, if it's in the elbow, Dr. Warren, I guess, left, but he could have told you that he had tendinitis in his elbow about 10 years ago and I fixed it in 5 minutes, he's never had it since. Okay, because the tendons are the ends of the muscle, and if the muscles contract, they pull on the tendon, then you get inflammation where the tendon inserts into the bone. So we have to stop the pulling, and then the inflammation goes away. We're getting to the cause. Yes.
I have two questions. What do you do for HIV, Hep C? I'm in addiction recovery, and a lot of my patients are in that problem area.
Okay, what do we do for infectious diseases, including HIV and hepatitis C? Well, we actually have treatments. We have treatments that are non-invasive treatments that actually will help the body get rid of the virus. Also, there's nutrients, whether it's our Ester C Plus or Immunomax, there are colloidal silver, and then you can drink dilute hydrogen peroxide. You can get hydrogen peroxide infusions, IV hydrogen peroxide. Oxygen is the strongest killer of viruses. Hydrogen peroxide is 3,000 times stronger, or more effective, I should say, in killing viruses than anything else that's been discovered. So oxygen therapy, including they could do hyperbaric oxygen, but even more effective would be intravenous hydrogen peroxide or intravenous ozone. And the doctors don't want to talk about it because there's no money in it. So we've helped a lot of people with both HIV and hepatitis C. And then it's confirmed by the blood work that they don't have it anymore. Yes?
Can you talk for a few minutes about this enterovirus that's going around and the Ebola?
Ebola, it's the same thing. I'm happy you bring that up because colloidal silver and peroxide would in most cases knock it out. They don't want you to know that because there's no money in it. Years ago they were talking about the avian flu. If you remember, they were scaring you about that, right? And some of you may be old enough to remember a guy named Burt Lancaster. He started a movie in 1961 called Birdman of Alcatraz. It was a true story about a prisoner in Alcatraz who became an internationally famous bird expert because birds started flying in his cell and he started raising birds there. And he cured avian flu with hydrogen peroxide. And it's in his book. I forget which page it is. I think it might be page 88. Somewhere in his book. You can get that book, I believe. Robert Stroud Jr., I don't remember the exact title of the book, something about bird care or something, on Amazon. And in there, he talks about curing avian flu, and it was written up in bird magazines. They don't want you to know about that because they can't patent it. They can't make any money. You have to understand the pharmaceutical industry is not out to cure you. They're out to sell products to you. If they cure you or something, then you don't need their products anymore. What do doctors often say? They'll say, you need to take this the rest of your life. What does that tell you? It's not curing you. Why not get to the cause and cure it, and then you don't have to take this stuff anymore? Keep in mind, properly prescribed medications are the third leading cause of death in the United States after heart attack and cancer. We're only 4% of the world's population in the United States. We're consuming 75% of the world's drugs, and yet we're 72nd in health. There's 71 countries that are healthier. This system's not working. And Obamacare was not health care reform. It was health care insurance reform It's just propping up, subsidizing a failed system. People are taking more and more drugs, and all these drugs create tremendous side effects by interfering with their body's natural functioning. We're not telling you to get off the medications. You need to get educated. Okay, I got to sign off because we have the next speaker. I'll stand over out there away from the seating area here. So if any of you want to come over, I'll answer your questions. Thank you very much, and God bless you.